This is a session where we're going to just talk through some of the digital IT elements of the Ealing Local Enhanced Services. We'll try to add a touch on some of the clinical elements, but it's really about just focusing on a couple of the digital elements which are new, just to make sure that you're doing it in the most logical way. I know that people are just literally joining, so I'm about to start. If there's clinicians in this call, honestly, feel free to multitask, because I'm going to try and touch on the clinical bits, but really show the operative team, the practice managers, the admin team, exactly what to do. If there's questions, please put them in the chat. If you think I'm missing something really big, jump in. Feel free to interrupt me. It is being recorded, just be aware of that. So as we said, we're here to cover the Ealing Local Enhanced Service Specifications 25-26, but only the alcohol and digital AI elements are going to be covered in this webinar. So as an overview, there are minimal or no changes to most specifications compared to the previous year. The M&K specifications have been removed, and this has been replaced by new specifications, alcohol screening and digital and AI. Now, what we're not going to cover are the other changes. There are changes to proactive care specification, and there are minor changes to healthy child carers and domestic abuse and green initiative specification. So I'm not going to cover that, but I'm going to show you one little thing that can help you with one element of healthy child. So mainly these two things here. If there's questions outside of these two things, you could definitely raise them. We'll probably have to answer them outside of this webinar. So just want to make sure everyone's clear that we're focusing on those two things. And if we look at alcohol, I'm going to focus right down to the KPI. So hopefully you've got that local enhanced contract and you've seen it, so you've skim read it. So the two things are, it's asking that over 90% of teenagers aged 13 to 17-year-olds have been provided an audit questionnaire. And then that is that you've provided them if they've not completed one in the last 5 years. And similar with adults, over 90% have to be provided. Now, I just want to emphasize one big thing. It's the word provided. You've offered it. You've given it to them, not that they've completed it. So please don't get any confusion with completion. You're not responsible for response rates, completion rates for any of this. It's just that you've provided it. And I'm going to show you how to do this on System 1. I'm aware, obviously, we have one practice on EMS Storm as well. If you're on this call, most of my presentation is not going to apply to you. We'll touch base outside of this call about how we can do this for you in the world of EMS. Beyond this, there is some training elements. So again, the clinical elements. Liz and the training hub will explain this more to you in email stuff, but there are some training sessions by Rise that focus more generally about alcohol, but we'll also touch on screening as well. And at the end of this, that training, there is also an e-learning module. So here's a QR code to access it. So it could be that just one member of the practice has either attended Rise training or attended or done an e-learning module. Right. So that's some of that wordy slide. Here's another really, really wordy slide. The digital and API KPIs. It's asking this whole list of things. So at least one health professional element has used medical scribe with at least one patient, and there's been some practice level discussion. That there's been some level of PCN discussion of different practice experiences of using the AI scribe. At least one receptionist, one administrator, one clinician in each practice signs up to an NHS app. Now, if you're being really smart, you can do this during this webinar. I'll be showing you how to do this, the QR code. You could do it in seconds. It's a really fast process. Then here, about the practice to engage in a practice training session with the NHS app. Now, I can take zero credit for this. I'm going to give all credit to Finn and Liz and the whole team who are arranging this for you. And hopefully she's on the call, and later on she'll just explain a bit more about the working. But some of your practice have already started this process, and I know that the team have been reaching out to you to book this all in. Here's some really small details about showing a poster, a QR code poster to promote the online registration system by NHS England for your practice. Now, I've created all those posters for you. Again, we'll touch that later there. Some of them have started to already reach you, but we'll explain again how you can get those if you haven't got them. And we're going to touch on that you need to achieve over 60% digital uptake, that 60% or more of your patients are using the digital online route to register rather than using any paper forms. And then the pharmacy first referral process, that at least one attempt has been made to use a new functionality from TPP. And believe it or not, that could be going live in the coming days. So we'll just show you what that looks like. And then finally, that you've just confirmed that you've really tried to set yourself up for London Care Record and made sure you've cascade training to your practice. So this is basically what I'm going to try to cover really fast. And remember that if I lose you, everything's been recorded. So I hope you can roll back the video, watch at your own speed. But let's start with alcohol screening in teenagers and adults. So why on earth are we actually doing this? Well, the background is this, that Ealing has got the highest rate of alcohol-related hospital admissions in London. Oh, in a 2021 survey, so this is over 4 years ago, so things have moved on. 40% of pupils have said that they had had an alcoholic drink. And that increases with age. 13% of 11-year-olds have, and 65% of 15-year-olds have. And over 6% of all pupils said that they usually drank alcohol at least once a week. And remember, this is dated from 4 years ago. We can only imagine what those numbers are now. But if we look at the alcohol situation in Ealing, we have the 5th highest rate in London with alcohol-related mortality. So people are dying from this. And obviously, if we look at the whole 10-year plan and moving from, prevention rather than reaction, surely, thinking about our children before they become adults would be something that's sensible. But I completely understand the concerns that practices may have about this. So I'm going to touch on that and explain how this is going to work. VJ Taylor, I don't know if he's on the call, but he asked me to bring this to your attention. So I don't know if any of you sign up to some of these random emails, but I'm on the email list for Redwell, one of those educational providers. And this is an email that dropped into my inbox about a week ago, saying there is no safe limit of drinking. What's the missed message? Just promoting the whole case about alcohol being a growing problem. And it again makes links to the 10-year plan. So I think the training hub, they'll also cascade that out. So you're just aware about that even free message from Redwell about alcohol too. Okay, so let's go back to the nitty gritty. What are we meant to do? So, like I said, we're offering this alcohol questionnaire, and that can be via text, email, or NHS app messaging. And that can be really to all patients aged over 13. We'll come on to that. I have excluded a few patients, things like palliative care patients that might be, inappropriate. But yeah, generally all patients. And then you offer brief advice and support. And when I talk about this at the minimum is just a message back. And I've created all the messages back. So, if someone did score high, we're going to show you that all the messages created, you could just text them back. And that's the minimum. Whether you want to do more than that, Rise will be doing training. So if you want to offer anything more, that would be great. But the minimum is just at least a bit of messaging with some direction and signposting to services. And like we said, at least one health professional has to either done the e-learning module or attended some training by Rise. And that's the minimum. Obviously, it'd be great if more of your staff did feel that they wanted to engage in it. So first of all, how does that invite work? And I've just literally screenshotted the actual text messages because this is the first bit of sensitivity. Here's an example of an adult message I've created for you in Communication Annex in System 1. So, it's just very direct saying, we'd like you to complete these questions about alcohol, and it's got the link there. You can see here that there's an access code. Now, that's something new that System 1 rolled out a couple of months ago. I'm going to ask you to turn off the access code to just increase response rates. I personally think it's the access code offers no security. You can see that the access code is received in the same text message that goes to the patient. Even if it went to the wrong patient, they've got the access code. When they click this link to access the questionnaire, they have to enter their date of birth. And personally, I think that's enough security to think that you sent it to the right patient. With teenagers, I've crafted it more delicately. And I just wanted to say that I think this is the first thing to mitigate concerns. I framed it like this. First of all, it's directed to the patient and guardian. So, dear patient and guardian of the patient. So here it's a test patient, William. Around 40% of teenagers have had an alcoholic drink, according to a national survey. So really, if you think about it emotionally or psychologically, I'm telling the parents, look, the reason I'm messaging you is you may think it's crazy that I'm messaging your child, and you may think that no one drinks, but I'm actually saying that around 40% drink. So I've actually introduced with that statement. And then I've gone into, we would like you to complete some questionnaires for William. Now, it's directed to the parent guardian. partly because of this age group, 13 to 17-year-old, a lot of the mobile numbers are probably going to be the parent guardian. But even if this was that you had set up the child as being the main reciprocant, I think when they receive it like that, that's absolutely fine as well. And it's framed in a way of things. But I think it gives you the first assurances that, even if you sent it to say, Dear William, can you complete this questionnaire? You're 13 years old. And you think the parent's going, why on earth have you sent it to my child without me being involved? I framed it in that direction. And when I put the context that I started out by saying, whoa, actually, I'm telling you that a lot of people drink as teenagers, they're not thinking I'm absolutely mad to be sending this questionnaire to their child. And what I think it even does is emotionally, like even if you're a parent and you've got a child, you really know that they don't drink, or you've got them there, you're going to probably help complete this questionnaire for your child, even if it's just a feedback that they're just not drinking. And I think even if you were offended or you thought that your child was drinking or you just were too busy, you're just probably not going to respond at all. So this is the first reassurance that you have as a practice. You have to do the offering. You're not responsible for that response rate. So hopefully, I hope this little detail about think about it. So, and how the wording is the first reassurance about screening children. Visualizations. Now, I've done this as a visualization. Now, this is where I want you to go to system one. If you don't really know about visualizations, just follow me. So go to your search bar in system one if you've got it live. Just type in visualization. You should start to get this menu like here, and you can put launch visualization. Hopefully, I don't know if I need to give it a few seconds if you're all on system one, but yeah, type that into your search bar. And then hopefully you've got this. You've got a screen that's popping up the visualizations asking you, what do you want to select? And I'm saying go for alcohol because that's what we're talking about now. I will touch on the healthy child later on. If you now click on add alcohol screening, hopefully you're with me now. So you've got this live on system one for your practice. So you're going to be seeing different figures, different things. It may not even be showing you anything if the reports have not fully run, and it should trigger things to report. Now, I just want to walk you through this visualization to understand. So visualization is hopefully how I think is a better way for you to engage with reports in a more interactive way. You're not having to work out where on earth is this report in system one and what am I meant to do. So on the left-hand side, this is showing you who the reports that I think are identifying who you need to still offer to provide the audit. So breaking it into teenagers and adults. And I think that's really important. Everything throughout is broken into teenagers and adults because I'm using different messaging and to nuance it for the experience for teenagers versus alcohol versus the adults. You just saw how I sent different messages to the teenager. You saw it as a parent. So it is separated throughout. So that really helps you to make sure you're sending the correct messages to the correct patient. So if you look at teenagers, if you look at this visualization, you can see this sort of eye icon. That actually will link you to the report. If you click on it, behind the visualization, you'll now be able to see that report deck for that patient. So you don't have to navigate the report in. It's pulled up the correct report for you. Now, the only problem is you can't see it fully without closing the visualization. You'll see it hidden by your visualization. Bear with me. Just hopefully you can see that it has pulled the report behind it. I don't close it right now. But the next thing is, if you click on here, this is a communication annex. This will just show you the correct communication annex message to send for this role. Now, what it won't do, okay, if it's saying no patients coming up for you, try maybe clicking on the eye. It will trigger hopefully running the report. And if you run the report, it will probably start triggering that this visualization will update and it will start showing you numbers. And it is probably because the reports haven't yet run. And then you'll probably see the visualization will update for you. Okay, Pound, great to see that you've got your list. Probably means you've done it. So if you can't see any numbers, try running this, open a report, use something on this trigger and close it, the visualization. What I can also do is I can flip to show you how to find the reports to run them. But once you do start to see the numbers, the communication annex in each one is just for me to try and help you to show you this is the correct message to send for this cohort. I'll just go quickly through how you're going to invite them in a mo. But this shows you the teenager you need to invite. This shows you the adults need to invite. Then as the responses come in, there's sets of reports which will automatically show you the scores and reports that are coming in. So here is the highest category of the alcohol scoring, really possibly highly dependent, high intensity drinkers. this is a higher risk category, an increasing risk category, and a lower risk category. This aligns to the different audit scoring categories. So it gives you the different cohorts. So it will give you the numbers. So first bit of reassurance is with all the children that I scored, and in this practice, I just want to say that I'm very lucky that I'm working in a Gurinanak Medical Centre. It's a Southall practice with a branch that still has a very strong demographic of Southall, the cultural, lots of Sikh Punjabi patients who are not drinking. And this is one of the concerns that definitely has been raised, cultural sensitivity. Will they get offended, being screened for alcohol when a lot of them are not drinking? When this practice, in December, over 12,000 patients invites were probably sent out. And this is for all the teenagers, all the adults. And roughly, let's say they got around about a 15% response rate. And that's 15% roughly even in children and adults. Now, I don't think that that's that bad, particularly if we're thinking about the patient population, maybe more working class, language barriers, 15% actually submitted it. So it might be as a practice, you're going to get either lower than that or higher than that. You may get, maybe some practices may reach 20, 30%. So obviously the automation of this, try and make this as fast as possible for you to process is the aim of this whole construction of this visualization. So you'll see as the reports, as the questions come back, even if you lose them, you forget them, you save them into the record, and you didn't remember who scored high, the reports will track it and show you. And on this side, it'll show you who scored, how many patients scored in all of that, in those different risk categories. In my next column, it will show patients who you think you haven't responded to. So effectively, your safety net. So if someone scored high and you think that a response should have been sent out and my reports are not picking it up, they will be picked up in this column here. So at the moment, it's showing 0, 0, 0 for all of these as patients I need to respond to. So think of this black column as the scores that have come in and the response column as who you might need to respond to. Now, the lowest risk category, I put it in green because I'm actually saying it's not essential to respond to the lowest risk category. They get some feedback during the questionnaire process. And actually, the questionnaire even says you're not guaranteed a response. They probably don't need a response. There is response that you can send out to them, but this is also to help reduce your costs. If you're worried about SMS costs, messaging costs, you can see that the bulk of patients will probably end up in that lower risk category. And I'm not saying you have to respond. But if you do want to use these reports to respond, again, the same system. If you click on those eyes, you will pull up the list of patients there. And the communication annex will just, if you click on that icon, it will remind you what is the correct message to send for that patient. And then finally, on the right-hand side, just a bit of blurb about outcomes. This is tracking those that have been screened in the last 2 years, just as a marker of what you've probably done. Bear in mind that I'm knocking out any patient who's had any form of alcohol screening in the last 5 years. It doesn't even have to be the full audit. It could be a fast, a mini audit, just a code. It will knock them out. So I'm really trying to not irritate your practice with asking to screen patients who you've done some form of screening in the last 5 years. Please also don't forget that you've probably done a lot of screening in the new patient registration because it was part of that national contract. So again, they may be knocked out. It talks about those numbers that are completed. It's also tracking patients who have been either given advice or been signposted to some alcohol prevention. I've also tried to done reports to remove patients who are under alcohol services as well. So all of these reports are visible here. And hopefully, I don't think I've confused someone. Hopefully you've played with it while I've been talking through it. You can kind of see some of the logic. I'll now move on. So have a look at this to see the patient's experience of what that questionnaire is like. So like I said, they type in their date of birth when they get the text. They get those questions. They're clicking through. There is a guide to alcohol units at the top. I know the video's gone really fast. It's whizzed by it, but they get some guidance to what is a unit. They click through. At the part of the section here, it already gives them feedback about their scores. They can calculate their score by clicking calculate score. And then they can click commit to submit the score to the practice. I know that was fast. You may be thinking, why have I put a Tom Cruise Mission Impossible picture there? Because I've also designed it that what if they don't submit it? What if they've actually got some insight? They think, oh my God, I'm drinking too much. I don't want to tell my GP. I'm not going to submit it. I think you've already offered them some value of insight. So I just want to say to you, don't think of the numbers that came back. Think that even the people that clicked in and went into that questionnaire, you have delivered them an impact that is designed for dropout. I've designed that questionnaire, I've crafted it, I've got little signposts and links, resources. It even directs them to services like Rise and think how they can find alcohol services. I've managed it for I'll run that video again before, but I've even designed it for different areas. So geographically, I know that some of your practices, some of your patients are not falling under Ealing. It will hopefully signpost them. So I've tried to take that workload off you in that questionnaire. And just to give you some further assurance, we've tested it with different staff members. I've got the Rise team to test it as like patients to see that they thought there's any issues with it, any concerns with it. So that is the questionnaire process built in. And so I just want to show you how this will arrive back into System 1 for you. If you've not used questionnaires coming back into System 1, if you're so used to the Acrex ecosystem, here is how it would look in System 1. So I've done this as a video because obviously I've got to be careful about patient data. So the task comes into my inbox, and I've set it as an inbox. When you open up the task, it shows you all the questionnaire responses. And sorry, this may be a bit slow, but you can scroll down, you can see all what the patient responded. And all of this is being coded for you. So I've set up for every response the correct code. And you could just click on File to Record. And now I'm going to give you what a child thought of this.
And we look again at that test patient, which is now your responses. So I'm going to move it up. And we can see your response is now saved in the record. So what do you think about that?
I think that's clever.
Really? And how did you find it as a teenage type patient?
I found it quite simple.
Really? And how would you feel if you received that as a teenager and it suddenly arrived on your phone? What would you do?
I would ask my parents about it.
Okay. And what do you think your parents might say?
They would probably say that that the NHS people are doing a screening thing and that you need to answer it, or they would say don't answer it.
Yeah, that's true. They may, and it's totally your choice. Your parents, and you may feel like you don't want to answer it. Absolutely fine. And do you think they might even help you with looking at answering it together?
Yeah.
Yeah, that's possible. And so now that you've seen that, so you know, in the beginning you said I could do it by email, by video, I could ask you to come in. What do you think is good about this method?
It's easier to just see the questions laid out like that.
Okay, I don't know if you I hope the sound did come through, but basically yes, I did subject my my own child to do it, and actually she was younger than a 13-year-old. She was 10, and I didn't tell her what it was. I just literally said, look, would you mind if I just text it to her over my phone and you play with it and do it? So she got it as a 10-year-old, and those questions I asked her and her answers, I didn't plan them. I just asked her honestly, what do you think you would feel? And that's a 10-year-old. So I just want to give you some assurances, like if you're worried about the impact, if it arrives in parents' mobiles, or can a child actually do it as well? 10-year-old found that straightforward. Clicking, I didn't give her any comment. I did tell her the date of birth she needs to do for the test patient. That's all I did. So anyway, that hopefully shows you how it arrives in System 1. When you see it in the records, it's all coded for you, it's all scored for you, so your workload is really low. And now to talk about responding to risks, I've crafted the different text responses for the different categories of risks. And I just want to be really, really clear about this. I've done ones here that are for adults and ones for teenagers. So the wording's slightly tweaked. So, just sending that response through. You're not having to think through the wording. I've tried to design that for you. And again, I got Rise to check everything I've done. They're happy with how this is worded. It gives links to their resources. So it's all done for you as well. And you can do it in bulk as well. Remember, you can run that report, send it in bulk. But what you may find is as it comes in, when you do see that occasional high risk, you may quickly just want to react and just send it. But, as a fail-safe, if you forgot to, you've got those reports to pick up those high scores to make sure you are sending those responses back. Visualizations, I have shown you obviously visualizations as a concept. If you want to learn more about visualizations, have a look at this EGP learning video. But let's move on. So a couple of now setup steps. So clinicians, you may be really bored by these bits, but these are bits that are really practical just to make sure we can maximize this. let's set up. I would suggest that you put visualizations on your toolbar. You don't want to get lots of emails or messages from GP partners saying, how are we doing on these reports? You want to say, well, just click to the visualization and have a look yourself. So maybe put it on your toolbar. And how you do that, obviously go to organization preferences, you configure, search for in toolbar, configure your buttons, search for launch visualizations. You'll find that one launch visualization, just add it into somewhere in your toolbar. But also consider adding it on your clinical tree as well. If you do that, actually, this is a bit more different. You can't just do all visualizations as a checkpoint. You actually have to pick the ones you want to add. So you might want to add on alcohol. You might even want to add on healthy child leaflets. I'll show you that in a moment. But maybe alcohol screening is something you might want to add on to your clinical tree too. But really importantly, communications annex, you can see I've built this all in for you. Please make sure you put communication annex on your toolbars for all your practice staff. You want to guide them to use some of my preset messages. And I showed you that thing about wording, but what I didn't emphasize is I've also made sure that I'm linking the correct code to sending the correct message. So you don't have the headache of did you send the message but put the wrong code, and then you've got some dispute at the end of the year thinking, well, why is you not achieved? All the blame you can then pass to me saying, Shankar, you put the wrong code in, you mucked up the reports, and I'll have to sigh heavily and work out the fix for you. But you can see that the whole process is built for you, and you can just hopefully worry less about using the right things. So again, this is the step I really do want you to emphasize. Please pay attention to this slide, and it can be lost in all the slides. Remember, I asked you to remove the access code option to improve response rates. This is something that that TPP put in just for me. They knew that we were going to do this work in alcohol, and I basically told them when I introduced the access code, you've just dropped my response rate, and I see no benefit from adding access codes. So they really politely rolled this out as a development request. So please do make the most of it. So if you go to the organized process, you put in access code, just unselect. You may be selected as include in access code for questionnaires and replies. Just unselect it. I genuinely think you gain nothing from it. It's just a barrier for patients having to cut and paste it out of the text message into the system on pop-up that emerges. I think date of birth is more than enough for this. And then finally, I have previously recommended you in the setup to convert from user groups to teams. Even if you haven't converted this, maybe this is your trigger, but I'm going to quickly tell you that you are going to need to set up a team potentially before you can send out all these communication annex presets. Otherwise, you can't send them to a user group. They can only go to an individual member or to a team. So just a bit of blurb. Why is it that we're asking you to change from user groups to team? Well, System 1 said this back in 21-22 that they're going to replace user groups with teams and to switch. All the newest System 1 functionality only use teams and not user groups. And Communication Annex is one of those big examples. System Connect is another example. So moving over is really important. And this is maybe a good time to do it, maybe slightly quieter in practice to think about the switchover. If you do switch over, the difference is your users have, when they send a task, they're used to thinking about user group. Now they pick a team. And when they pick a team, there's a drop-down option of the teams that you've set up. And in user preferences, if you've set up user preferences to send to a particular user group, you may need to adjust it so that they set up to go to a team. And the first step when you're thinking about teams is you have to go into organization preferences and adjust which staff members can actually configure teams. So again, organizational preferences, if you look at teams, firstly, work out who you allow to play with teams. And then when you go to set up user and profile and you go to configure teams, that's where you can set up a team. So even if you're not doing a switch over from user groups to teams, which is what I recommend, to at least get going with this, you may want to set up a team. Think of it as a rebranded user group, just to manage responses coming in from alcohol. If you go to there, configure, first step is you go to new teams, and you just need to think of a team name. And just under Commission CCG, just put Northwest London. Once you've done that, the next step is you can edit the staff that are in that team. So it's just like a user group. So put across all the staff that you think wants to manage that team. Right, now that you've done that, if you go back to the old-fashioned report, so if you weren't sure with the visualization, if you can't find the reports, go to Northwest London ICB, North Ealing local PC enhanced services, go to alcohol, select all of them and run them. And I'm saying, if we use an example of how to use Communication Annex, now this may seem a bit patronizing to some of you. If you've used Communication Annex to send questionnaires and stuff from reports, just fall asleep for the next moment. But if you're used to using Accurex and stuff and you haven't used Communication Annex, I just want to make sure you're clear on this. So if you look at this example, if we look at to offer the audit for teenagers, you highlight report, so Ravinda, definitely the slides going out and the recording. So all the slides you've seen will be circulated. So when you get a report, you go page by page. So it's limited to 250 pages at a time. So you select all. I've blurred out all the patients in this report, obviously. So you select all. You then click on this Communication Annex box on the right. So you've selected the patients. You click Communication Annex. Then I'm saying you click on Preset. You search for alcohol, and then you choose the correct invite. So for teenagers, use the alcohol screening invite for teenagers and click UK. Obviously for adults, use the one for adults. So this is the only thing that could go wrong if you pick the wrong one. So just make sure you've selected carefully. And here you'll see that it's done for you. It's linked to my alcohol screening questionnaire. It's linked to the code. You don't need to think about anything. And here is your dilemma. Either if you haven't set up a team, you can send it only to a staff member. So that one staff member. Or if you have got a team set up, you can select that it goes to the team. So that's why you may want to think about assessing of a team before you run this. And the other bit of final blurb is you may want to just adjust the signature. It auto-populates the staff member's name, the thing. Please, please, please put some form of staff member in there. I would encourage maybe a GP partner. You can blame me for if they complain, why did you GP, why did you put my name in the business? Because you're going to get a higher response rate if you put a GP partner, parents and stuff. And also if they did get annoyed, they'll obviously come back to GP partner. GP partner will then come back to me saying, Shankar, you told my practice staff to put my name in it. You're going to have to handle this. So I'm just adjust the signature, but put a staff name and please put your organizational name in here. Remember that the patient gets lots of text from lots of different organizations in the same sort of text conversation on their phone. So if you don't put organization name, it just creates confusion. Okay, and just repeat the process for every page of every 250 patients on it. Now, I know that is slow. You're doing it every 250 patients, but I think hopefully you've seen it. It's still faster than if you did this by Accurex or batch because the whole process is built for you. And with children, and it also gives you some control. If you're worried about being overwhelmed by response rates, you could obviously phase it and do them in batches as well. Right, Victoria, hands up. I'm happy to take a question now. So do you want to come in?
Yes, would you mind just quickly showing in Communication Annex exactly which one? Because I'd gone into lifestyle and then alcohol questionnaire, which clearly isn't the one you'd pre-populated because there's so many different options.
Yeah, there is something. Okay, and I know there's lots here, but look at the one that says alcohol screening invite. You've got two. You've got alcohol screening invite teenagers, and my red box is hiding the other one. But you've got one above it, alcohol screening invite adults. There's only two that's for inviting in. All these other ones here are generally responses. I've created. There's a few that, by the way,
if you go into lifestyle, so what's the sub one you're searching? Because I went into lifestyle.
I'm just saying, that obviously it's in the folders, but I'm just saying use the search bar at the top because it's going to be quicker. If you type in alcohol, you'll get this return, and you'll find it quicker because the folders. I've created hundreds and hundreds of there. Even scrolling down and find the folder, I think you'll find it faster by just searching. And again, I've always been raised to system one to put that search functionality even higher up in Communication Annex. It's quicker to get to search because I think, and it is again my fault, I put hundreds and hundreds of presets in here. So those folders are becoming quite cluttered. So you may find search easier. Okay, I'm conscious of time. I'm going to hopefully, alcohol was probably the biggest thing to cover today. I'm going to cover the other things in a lot faster fashion, but are there any burning questions we want to take before we move off alcohol? Do you feel generally you got the gist of the visualization, the reports are built for you, the questionnaires built into system one, it comes in as task, it clicks just to store it into the patient's record, and then you've got fail safes to run reports if you've forgotten who you need to respond to. Any questions at this stage? Elizabeth,
we've got a couple in the chat. Yeah. One question is this sent as an SMS or an email?
Okay. You have the option of communication annex. You know, when you see that drop down, you can select how you want to do it. So if I go back a step, you know, when you says here, this screen here, you have the drop down of do you want to send by SMS, send by email? They're days, maybe worst case, weeks away from having NHS app as well as you drop down. I'm just going to give you an open and honest thought. Personally, I would really appreciate if you consider text first. I know that you're thinking about costs and budget. We have budgeted in payment of this towards text costs. We will probably get a higher response with text. But I totally understand if you're thinking about email. Email's obviously an option. We'll probably get a lower response, and I appreciate that that will be also a cheaper option for you. And in the future, NHS app messaging should also come in TPP in this drop-down list. I think you'll get a lower response rate than SMS. Personally, I would ask you, could you just consider email, particularly if you haven't got the mobile number or something? But I'm not micromanaging this with you. I'll let you do it. It's just how you feel about response rates. You're not being monitored on it. You're not being performance management response. We're only tracking you about offering, but it would be great if you could make a bit more of an impact. What I do think though is if ever you, and I'm only asking you to offer it once, if ever you were really, really, some practices may want to take it further, they want to look at responses and chasing it more. You're not being asked to do that, but then clearly you might then want to change your modality if you're doing any further follow-up.
Anne has asked, if you email it, do the responses come back into the task box?
Yes, they do. It comes back through. They click a link. Basically, the link that comes through the text message just goes through email. They click the same link. It comes through in the tasking box exactly the same way.
And a question, can the responses be bulk actioned?
Yes, you can. You can highlight in your task box. Can I just say one, and it's quite satisfying to do. What can I just say? A couple of risks, and they're not big risks. If you do it in bulk, like for example, I use more questionnaires. I use not just alcohol. I use mood. I have built a mood questionnaire, PHQ-9 and GAS-7. I personally find it easier than the Accurex. I made that myself. Be careful because if you're doing a bulk highlight, if you've got lots of different questionnaires, you may do it. So you may want to just use that filter. You know, when you look at your tasking box, do you just filter it? When I say filter, you select, you know, online questionnaire. So you're just going through that inbox in bulk, but you can do it in bulk. I'm sorry, I'm probably not describing it well. When you look at it and play with it, it'll become obvious to you. Just be aware for that. If you send out any other online questionnaires, you may get a mixture, not just alcohol. You may have other questionnaires coming in. But if you're just doing it as alcohol, your practice is not sending out lots of other bulk questionnaires, then this is really straightforward to do it in bulk. And remember the fail-safe. Even if you accidentally went through it and it bulk saved them and you realize, oh my God, I just saw there was a score that was really high and I just saved it and I can't remember which patient and I've just done a bulk of 30. Do I need to go through the 30 now to work out? Please don't panic. It will be picked up by that report. And I promise you, I've done that myself with like even 10 patients where I just think, have I just missed it? And I can't remember. And I've looked at my report and I have even double checked the report by going into it manually. So it is a fail safe if you make a bulk error. Any other burning questions before we move on? And can I ask, are we okay to go over a little bit on time, maybe going up to 2 o'clock? I think we were hoping to do it within 45 minutes, but I know I've been a bit slower than I thought. Okay, so I'm hoping that you can hang on and we can keep going to 2 o'clock. So healthy child leaflet. This is something new that I built. And you probably think, Shankar, why didn't you build this a year or two ago? And then I did say to Tamsin, and so I apologize. I think I wish I'd done this for you last 2 years. It just makes you easier to work out who's received it and who's done it. And it's now linked to communication annex presets. So if you created any messages before to send it out, could I ask you to delete them and use the communication annex presets? And I'll tell you why. It's more optimized. When you use and again, it's the same system. If you press the I, you'll see the report. This is showing on the red who we think you still need to invite. If you click the I, it'll give you the report. If you click the communication annex, it will load the correct communication annex so you can see what is the correct message. The reason is I've also optimized the web link so that it's a shorter link, it uses less fragments, and it's more trackable. So it has a lot of advantages from using this. If you've sent out bulk messages in the past, I know that's frustrating. If you can remember when you sent it back and you didn't put a code in, if you can go back and put in this code, So I put the code at the bottom. Health care services information leaflet given. That is the code that we're using to represent that they received this. So if you did some bulk stuff in the work and you go back, that can obviously reduce your potential text costs, that you're not sending it again. But in some ways we don't mind obviously if you send it again, because obviously there's repetition. Certain parents would have ignored it. But if you're trying to look at your costs, then you may think you want to do from previous years some retrospective coding. The other thing I want to just explain about these reports is I've created these reports to track the age of the child changing. So suppose you did send a leaflet and you coded it like a year ago, and they've now moved into the next age category. My reports will pick that up and point out that you now need to send that parent or that child the report for a different age category. So the intelligence is done there for you. It's not just tracking when you did it, it's also trying to work out, has a child changed age since you last did it. Please be reassured, we're not micromanaging any of this. We're not going to let any of you say you missed one kid out. It's just trying to make it easier and more manageable for you to do. Okay, so again, the reports are here if you didn't use a visualization. And again, the presets, if you search for a healthy child, you can see the preset messages here. So there's 3 different ones, and I've labeled them for those age categories. So hopefully you won't send the wrong one to the wrong age category. It's quite it's quite obvious in the naming of the preset message. Okay, so we are on digital and AI bit. And this is a recap of all the blurby stuff we've talked about in the beginning of this webinar, all those specs. I'm going to race through it, but I'm also just going to focus on what I think is the top issues here. Liz, can I just check? When I shared video before, the sound did come through, didn't it?
Yes, it did come through. Yeah, okay. We've got a hand up from Latta. So what was your question?
I am sorry, Shank, it's Carolina here in Latta. Just a quick thing. For the previous topic that we were talking about, the audit for the teenagers, when you're sending communication annex, if we are working with teams now, so I can select, do I need to create another recipient for that?
No.
Or it's doctors and they will, the doctors will pick up?
No, not at all. So basically, when I explained about teams, and by the way, guys, I'm always talking System 1 teams here, not MS teams, to anyone else listening. I really talked you through 2 options. What I would like you to do is convert all your user groups to teams. I would and Karen can echo this, that it does sound like a pain, but it can be done like literally overnight, and it's not too much disruption, particularly if you keep all the names of the new teams the same as your user groups. But if you just don't have time, I don't want you to delay you from going on with alcohol. Just create one team for the purpose of this. So I'm really giving you 2 measures here. Your best plan as a practice is to convert from user groups to teams, but you can still run user groups with teams and just create a single team for the purpose of this questionnaire.
So it'll be like an admin team.
So sorry, but for us,
responses.
Okay.
Yes. So for us, there's no issue. So if you convert it, so you don't need to create a team just for this. You just have to think: have you got an existing team that you think is appropriate to receive it? Or remember, like, you can still send it to an individual. Obviously, there's risks about that. If the staff is on leave and stuff like that, or is it overwhelming for an individual? But that's always an option as well. It's just about who receives the responses.
Okay. And the other thing, Shankar, do you have any plans to create something like that for the diabetics? So, for example, to have the 3 Ps and all of these things?
Yeah, I think I'm hoping if practice embraces and understand this, surely you'd want everything as much as possible to be done this. And I know that there are some networks and practices that have done this over the last couple of years. I thought Active Network had built stuff around things as well. I've always encouraged this mentality, which is, I think, although the functionality is not quite as good as Acrorex in some ways, the fact that it's built in, I find it's easy. You're not worrying about an inbox that you've forgotten, but you can also customize really well. Although Acrorex you can also customize, there are some things you can do with questionnaires that you can't do with Acrorex either. And also, none of this has a cost. So if in the future, as a practice, you have to pay for Acrorex, you might decide that this is better. So definitely shout out. I've done things around mood questionnaire. I think diabetes is a huge need. And in fact, I have like diabetes and visualizations, surely the biggest thing that North West London needs to do for the 5 boroughs. Okay, I'm conscious of time. So Probably
Yeah,
gonna,
we have one more question.
yeah, I'm going
about
to
the healthy
talk
child.
about so Surinder, your question. No, you don't need to send it to the same kids every year. If you want to, great. We would love you for that because obviously it improves response rate. You just at least have to send it to each child once when they've been in that correct age bracket. So past work in previous years do count. This is just a continuation of it. But all we've done is we've built you the IT late, sadly, on visualization and with the communication analytics to make it easier for you. So we'd ask you to just delete or remove any approaches that you had in the past and now switch to this approach and retrospectively code any work that you've done if you want it to drop out. Okay, I'm going to move speedily on. I'm not going to show you this video, but I've made a video demo of an ambient AI clinical scribe, and this is using Accurex. First of all, it's a big caveat. Accurex Scribe is not currently yet approved by Northwest London ICB. So you may ask, why have I shown that demo? Why have I chosen this video as a demo? I've done this as a video demo more because it shows System 1 integration, which doesn't happen at the moment with Heidi and Tortoise. So I think most practices are exploring Heidi and Tortoise. They're all working on integration. This is a product that does have integration, and probably I evaluated it also from a integration perspective. So you can show you the integration perspective and what might arrive in with the other platforms too. So if you did want a video to look at, or you wanted a practice discussion, you could look at this, but be product neutral. This is just one product. There's multiple products out there. My video is meant to be tongue-in-cheek. It was totally random, so might make you smile. And there was child labour used in the production of this, so no criticism for this too. So just have a look at it, maybe make you smile, but it's something to help you if you want to have none of you in your practice have thought about this. Okay, this is the big problem here, which probably is what we need to talk about. This clinical safety cake, and this is the complicated thing, is talking about lots of different things that you're meant to do from safety. And this is obviously all the emails, all the WhatsApp messages that you as practice managers keep firing to is about this. And the first thing is that this applies to all the digital products you do, not just Ambient AI Scribe, but you're all waiting for us to help you with this, and we're the bottleneck. Now, credit firstly to some, I hope Pawan doesn't make me shouting out her name, but she's one practice manager who, without any real support, has pulled things together and submitted something as a DCB 0160. And if none of this means anything to this, hopefully if you look at this cake, you'll understand a little bit more about what these are. But effectively, think that as a practice, when you look at digital product, the product should have what we call a DCB 0129. Think of it as their own assurances on their safety of the product. So you'd want to have seen that DCB 129, feel assured by it, and then you need to complete a DCB 0160, which is your check to think you feel safe to deploy that product. And this is where it all goes wrong, because that form is clunky, jargon, is unfamiliar. You're going to feel like I really don't understand it, and you're going to feel just another long form that you need to do. Now, first of all, this is a legal requirement nationally. It's not even totally just linked to your ICB or your NHS. It is under review, so there is a consultation about this nationally. And the hope may be that they realise that this is a bit unsurmountable for every practice to do this for every single product. And maybe this will change in the future, but at this point in time, it is a requirement. The next question will be, well, surely the ICB can complete this for me. Can't you, Shankar, give me my ICB 160? Well, unfortunately, it is meant to be your checkpoint, and it is about deployment in your organisation. So it's a bit like me asking me to check your fridges. I can give you maybe a guidance, well, maybe do this or do that, but I can't do that physical last sign off. It has to be at this point in time, your practice. But there's surely ways to learn from this, and not everyone reproduce the wheel. So there are people so the ICB is trying to give you templates. So, Ishani is our digital strategy lead in Northwest London. You've hopefully seen her webinars where she's presented the products. I'm not going to reproduce the webinars. She has said that comms are going out. I know that I keep telling you the comms are going to come out, the comms are going to go out, the comms are going to come out. There's often twists and turns about products, suddenly a late change, a late thing. I'm genuinely hoping that things are going to start cascading over the coming days or weeks. So I know I've asked you to be patient, but this is a Northwest London consistent approach where you'll get some guidance, some templates to go. But if you're struggling, obviously reach out to each other. I don't want everyone to bombard Power, but clearly there are some practice managers that have done some stuff. But if you're thinking about who should take the lead in this, it should be someone that's had some clinical safety officer training. So it's a CSO type role. And the next problem is, well, who is trained? And I think you're going to find that in your PCNs, in your practices, you're going to struggle. And maybe this is the next journey that as a PCN, do you have to discuss it as PCNs? Do you have to think of having one person trained? There are training courses run by NHSE. They get booked up well in advance often. Sometimes there could be a cost that applies to attend or not. So just think that through. And I would say discuss it maybe at least at PCN level. And remember that this whole AI thing is about practice experience and discussing at PCN level. And there's also DPIA, a sort of impact assessment that you need to complete as well. So I genuinely do sympathise that this seems overwhelming. I'm saying be collaborative. I'm genuinely saying do this at PCN discussion level would be the right approach. And then I'm saying if you're worried about the bureaucracy that you've not approved it, not done it, I'm asking you to think about just testing it in a demo live environment, because I don't think you can understand risk until you actually use it or test the product. Get your GPs or health professionals to test it on each other. Use one of the products, see the learning, because then your practice may have a viewpoint of the benefits, and they'll be more motivated to either do all the safety sign up or not, or you'll understand some of the risks before you actually go in with live patients. So I'm just saying, don't let the clinical safety note block you completely. Keep an eye on all the Northwest London comms. You can, we'll really try my best in the Ealing WhatsApp group when things cascade to help, but just play with it without patience initially if you've got concerns. Okay, I'm going to show you this video. I love this video. I think it explains the risks more than anything I could do in a slide.
Can ChatGPT provide Death Star medical service when the humans are finally eliminated?
Listen, couple of things. Number one, people think, oh, ChatGPT will replace us. No. ChatGPT is what this Padawan uses to write her papers. ChatGPT makes us all look good. I just use it to do everything. I go, I need some admission orders. ChatGPT, help a brother out. And by the way, it's all how you architect the question. I just say, ChatGPT, I need a dope-ass admission H&P for somebody who's old, found down in stool, and I don't know what's up. And it's like, working. And it just, there it is. Could it be right, wrong? I don't care. I'm done. The note's done. Click, check. Next thing, Veda's in the lounge, sipping that Cool Rig coffee. All right? All right? You think I won't get away with this? Come on, people. Dark side for life.
Okay, and I'm going to go back to that risk. And by the way, when you talk about the risk, if you didn't see this was a few weeks ago, Sky News said doctors are using unapproved AI software to record patient meetings. Investigation reveals this comes to all those safety checks we talked. Someone must have leaked something to the press and they picked up on it. So it isn't just a tick box. It has even got media attention. And if you do look at that demo that I showed the link to, it is tongue-in-cheek, but you'll see that I am making small errors in that video, and maybe deliberately or not deliberately, to highlight some of the risks. And what I think when we look about the risks about the AI scribe, like Veda said, and by the way, I'm going to leave it on this slide so you can think about this while I talk about this. Like Veda said, we're all busy clinicians, isn't it? That AI tool will make mistakes. It will sometimes either omit some things. It will either imagine something was said that wasn't said. And you've got to review its output and either correct it before you save it in the patient's record. However, there could be a risk that as you get busier and busier, you either trust it more. Maybe you don't check it as carefully and you will save it with some errors into it. That's the first risk. I'm also going to say there's a second risk. I actually think we assume that, patients forget stuff in consultations. We as humans could also forget stuff. What if you look at the AI outcome and you think, oh, I think that's wrong. What if it got it right and your recollection was wrong and you're correcting it, but you didn't really pay attention to that patient and they did say that? So should you do that check-in before the patient's left? And should you feel comfortable to say, look, do you know what? I asked you that question I just want to ask it again. Did you do that? So maybe you did miss something. So it's a double-edged error, I see. The AI could make a mistake, or you could think the AI got it wrong, but actually you got it wrong and you missed what the patient said. So I personally think you've got to do that check before the patient's left, because a lot of these AI scribes are not keeping the recording. They don't want to keep the recording because they don't want you to be concerned about data, but you can't listen back often, depending on the product, to hear, well, why did the AI scribe say that? Can I listen to that thing? It's not like the phone call option. Bearing in mind that there are now in the marketplaces AI options that merge with your cloud telephony, so you can see how that could be a benefit. So I just want to highlight those risks of that. And then the final thing is, when you look at the integration, if it's just a couple of clicks to save, like you can see from that demo, that you don't even have to cut and paste it in, is it that your staff will eventually just keep clicking really fast and not check it because it's so easy to save into the record? So your risk gets even higher when the integration comes in. So I think just think that through, as that you've got to also not go too fast with using that scribe, and make sure that, I think, is a top risk to think about. And I'm sure that staff won't really tell the patients clearly what they're using, what products they're using. The patient won't even really understand it. So do think about, even though the DPO has, North West has given some different things, do think about, do you want to put some general comms in your, practice website, in your telephone messages, post in the waiting room, just to protect if your staff was using it, the patient felt they weren't told and they suddenly raised a concern about it. Just think through those risks. Okay, I know we're running out of time. We're hitting 2 o'clock. I'm going to go really fast. If we can stay over a couple of minutes, I'd really appreciate it. But I've left this slide up for you, thinking that, if you'd looked at this slide while I was waffling, you might have even become an NHS app ambassador before then. So we want one clinician, one administrator, one sort of, hopefully practice manager, at least 3 of you really to become it. I'm going to put a challenge. What if, who's the practice could get the most people signed up? Is there a practice out there that could get every single staff member signed up? Okay, that may be a bit of an immature challenge, but what do you lose out from it? You lose out nothing from it. You just get occasional emails. You get more in the loop on a mailing list with updates. You do get invited maybe to some additional webinars, and actually some of those webinars are really useful because you can really ask the problems to the people and get some decent answers. So you've got nothing to lose from becoming an ambassador. And even if you think you don't understand anything about an NHS app, surely that's the best way to learn. And just want to highlight, in terms of NHS app promotion, you've got some standard template messages in Communication Annex. Let your staff know that they exist. If you're struggling to say, well, how a patient says, how do I view my records in the NHS app? Use my preset messages. I've created them. It gives a video link as a walkthrough. It shows them how to find it. So it makes your staff feel empowered to tell them how to use the functionality. So just know that they exist. Anne, do you want to come in with a question?
Yes,
okay,
sorry, I'm off of mute.
Yeah.
Just a really quick question, Shankar, and this is, I guess, it's really, really frustrating us. How do we know which of our patients has got the NHS app and which hasn't?
Okay. The technical answer is you are stuck. You're stuck with TPP. And I'll explain the problem. The problem is, and I've had meetings with TPP to say exactly that. I said we need within TPP to see that they've got the app on or off. The problem is NHS England are giving TPP a report of every single patient in England, their status every 24 hours, an updated report. So they've got this logistical nightmare to sort this data out and give it as a rendered data set in our thing. And this isn't just about how they got the NHS app. What we also need to know, how they got notifications turned on so we can send them the message. So there's actually 2 things we need to know. And actually, we need to know that in Communications Annex. And when they show us the option to send an NHS message, we would want to know at that point in time, do they have messages turned on? So I've actually sympathised a bit with TPP. I've asked them, I've worked with them about what other solutions. EMIS does give a feed of NHS app into their EMIS system, but I think the data quality isn't as perfect either. So I'm hoping that TPP will start to show us a feed. But I'm also really pushing back at NHS England, saying I've given them what I think is a technical solution to this problem, which is I think at the point that you have a patient record, TPP should be able to fire off a message to the NHS app team to know for that patient, have they got the app or not as well. So you've got it even at an individual patient level, because remember, even if a patient had it at one part, they could delete it off their phone and you don't think they're live as well. So you kind of really need a status. So every time you're doing a batch message or something, if they've got it or not. So I don't know if that's a long answer to your question, but at the moment you're right. What I do as a surrogate marker is, as a practice, if you can see that you got some reports about how they got online access, I think you should assume if their patients have not shown that they've got online access, and that could also include System Online, by the way, or AirMid, those are the patients to target, thinking that they probably do not have NHS app either. And I don't think you'll go far wrong. It probably won't just show you all the patients you should target, but it'll show you some of them. So use those reports in TPP, which show online access, as groups to target, generally for NHS app. And then when you're talking about NHS app and AirMid, this is a poster that we've printed out for you that I've made. So Finn and the team, hopefully it'll cascade to you. You can also obviously print it off yourself. Maybe with that confusion about AirMid and NHS app, I'm definitely saying promote the NHS app, but if you want to also promote the AirMid app, maybe this is a simple poster that you got that promotes both. It's got the download codes in there. It helps the patient to download it correctly for their different phones. It takes them to the right Apple Store or Google Play for their phone. It will detect their phone system. So it sorts out all that headache for you. And maybe the reason I'm also still promoting AirMid is, yes, some things still in the NHS app are not perfect. Things like record access are a bit still clunky. Maybe we're still promoting both to maximise their experience. Yes.
Sorry, I got a question for you. So, with the AirMid, and can the patient print document from there? Because the only problem that we have is with the NHS, when we send the patients to look at the records, and they come back to us and saying, I want to print my records. I cannot print my vaccination or whatever for university or something like that.
So in AirMid, I think it is more exportable. So that's one of the main reasons I promote AirMid for record access. I should think it's more formatted and structured better than the NHS app. And remember that you don't need to give them a System Online login. They use the same NHS login, same NHS account to use AirMid. So still only focus on promoting NHS app, NHS login. But just signpost them to using AirMid as well.
Would you be able to give a feedback to the NHS app to trying to allow to print? I mean, we are trying to be a green environment in the surgeries to avoid this printing for them. But if they're going to be using the app, they should be able to print as well.
Yeah, I think they are already aware. I'll definitely keep highlighting it. And it's a case of when or if the functionality improves. Okay, I know I'm going way over time. By the way, people need to drop off. I totally understand. I'm going to keep racing through. It is all recorded. So the next thing is digital uptake report. So online registration, you'll see in the KPI, you've got to achieve more than 60% of your patients register online versus paper. Now, Karen Lutton, I know you're on this call, and I hope you don't mind then if I sing out your praises, because I'm going to break the stereotype. The first response is surely Southall, our patients, they can't do digital, our demographics. Now, if I show you where our practices are achieving already, this is a list of the practices who are under 60%. This is based on the last 3 months. The data is taken from a snapshot from literally last week, 15th of July. So if you're on this list, you're the ones that need to get above 60%. Okay, so you're on this list. Now, these are the ones that are achieving, you're above the 60% that's already. So you're already above it. So congratulations. You could say, you could put your feet up, you could ignore it. But you can already see lots of practices, lots of Southall practices who may have thought, well, it's a challenge to achieve this, are already on this 60 to 80% threshold. But the only thing I would say to you is, don't be complacent. You could slip down when we measure it. You might be just on that 60% threshold. Could you still go any higher? And then look at the ones that are on 80%. So already in Ealing, all of these practices are on 80, sometimes really high 90s, that they're hardly doing any paper registrations anymore. And you can see, and this is what I'm singing out, and I'm like literally, the practice I'm working at the moment, Guru Nanak, they're above 80%. And, so if I want to just shatter your mindsets, if you're thinking we can't do it for our patients, can't do it, and a lot of these practices haven't even really tried, they haven't optimized, they haven't thought about things. It shows you that our patients are actually doing things online without us even steering them. They are now busy people who, when they want to register, they're going online. It's not even our efforts at achieving 80%. So I just wanted to shatter your fear, because we definitely had some feedback that 60% sounded really hard, that it is a very gentle target. And all of the 80% people, I do think you could probably put your feet up, but the 69%, if we look through now what you need to do, why am I doing this? is to reduce your workload. If you get them to complete this online, you can do things now like auto registration with TPP. If you haven't caught my presentations or the slides, I did put a note on the notice board. Please do activate yourself through Profile Manager. You can see my slides to show you how to do that. That will reduce your workload. So every patient that registers online is less admin work for your practice to manage paper. I'm not going to go through this really slowly. I'm just going to flick through these. You're going to have the slides, but to improve it, first of all, make sure you've checked all your Profile Manager settings, but really just double check your catchment area. Are there some patients who your reception team are handing out paper because they say there's some catchment area glitch? Make sure there's no glitches with your catchment areas. Have a check of it. Ditch all the paper. Shred all the paper in reception. Any of those paper forms, just put them in the bin. Get your team to print on demand. They're more likely to hand over a paper form if they've got a pile of them at reception. If they have to print the paper form on demand, they're more likely to mention the online option too. Just give them the link. This is the link here. Either put it on a shortcut on their desktop or somewhere so they can quickly print off that paper form. If you're using a slightly tailored version of the paper form, remember you are meant to use the national form now. It's a contract requirement. You can only add extra paper pages on top of it. Even then, just make it as a quick print on demand for patients so that they hand it out only when they need it. Create your messaging templates. I think particularly about parents with new babies. If you create a template message like this, when your admin team gets a maternity discharge, can they just quickly fire off that message to the mother? Encourage them to register the baby online. I think that's one of the big wins there. Really look at your practice websites. I have looked at them. Most of the practice websites in Ealing are not completely correct. They've either got lots of different forms being promoted. So usually one of the top reasons you've got low digital uptake is your website is not clear and you're either promoting different forms that are not the national form. So really declutter, promote just that form, and the posters. So I know that not everyone has color printers. So we've printed out. So I've created for every single practice, I've created their own poster. Finn and the team and the Aged Care team are trying to get them out to you as printed versions, but we have got them all up to. So if you have a colour printer, you can get the file and print this off for you without any delay. You don't have to wait for it to reach your practice. But if you put that in your window, that is a KPI. We want proof. We want a photograph that you've done this. It might seem like micromanagement, but it just really helps show that you're you're open 24 hours for registrations. You're trying to reduce the workload of people coming into your reception desk and registering. And if you put one in your reception desk, your staff may find it easy to just say, well, I can give you this paper form, but could you also think about scanning this code up here? Maybe you can still try to do it online. They don't have to fumble for where is the QR code. Okay. Look at your telephone messages. Do they need any updates? Look at your email auto replies in your practice. Look at email signatures for maybe your leads in your operative team. Do you need to put the link for registration in those messages so it makes it easier to signpost to the digital update? And make sure your team just understands what's going on. Now have another practice discussion. If they realise that you've enabled auto registration, will that receptionist go, oh, okay, every time I hand out a paper form, I'm adding potentially more workload to some other member of the team in the practice. I've got to understand that this will save workload for our team. Okay, pharmacy referrals. There is a new TPP system on functionality going live. It's likely to even maybe start going live over the next few days. I'm going to just show you this video clip. Okay, there's probably no sound on this, but just to explain it, you'll have this new bars functionality. So when you click like this on this bars functionality, it will show you the pharmacist. You select the pharmacist and you can quickly put in some preset content like, what is the condition you're referring for? In this example, cough. What is the situation for the patient? So some narrative. So you can obviously free text or you can type in something and any other particular instructions. It could be this example here, please see patient, anything. I mean, that's just a demo video from TPP. And when you close the record, it fires off that referral to the pharmacy. So hopefully you can see a lot faster than anything I've built for you so far using word forms and etc. It is mainly for the pharmacy first clinical pathways or minor illness type referrals, not yet really meant for blood pressure or contraceptive referrals. We can come to that later. I've still created the template that you've hopefully used and that I built. We built for you with communication out presets. As soon as the functionality go live, I will update that template. So still, if your staff are going in through that template, they may get some guidance on, what are the inclusion exclusion criteria, so that hopefully they're referring more appropriately. But it will launch them into that bars module, so that I will remove that whole word referral form that I've built for you. So that will go live probably very quickly. And the KPI is that you've just at least tried it for once. I'm separating out the whole service issue about do you like pharmacy first or not. I'm just asking that you've at least explored the functionality, you've done one referral using the new functionality when it arrives. So that I don't want you like 8 months later to your team go, oh, we didn't realize it existed. We were still sending these emails or still using your word form, and then you've wasted a lot of time. And it is literally hotter than press. There's even a discussion later on today with TPP. So this is likely to go live very, very soon. And then the almost final slide is a London Care Record. There's a KPI just to say, please make sure you're set up and make sure your staff know how to access it. I have made a video on this. This is the video. If you just share this video with your practice staff, get them to know how to use it, you've probably achieved this KPI. And just get some feedback, because a lot of GPs, a lot of clinicians don't know it exists. They probably send tasks to admin teams. Can you chase this letter? Well, actually, your admin team needs to send back to them, well, have you watched this video? You can look at it and find it yourself. We're all guilty of that. Even I've done that at times. So make sure that you're aware of that London Care Record. And the video does show how to set it up for your practice if you're not set up. Okay, we've gone over by 15 minutes. Hopefully that was a useful whistle stop. I'm definitely going to know that the AI scribe conversations in the chat, I can definitely understand your frustrations to get the promises of it, that you'll get the guidance, you'll get the guidance. I can only apologise on behalf of the North West London team. I do know that they're very stretched. I do know that there have been some twists and turns which have been unexpected, like NHS England have cascaded things that reviews different positions, or new functionality has arrived that changes their assessment. So just bear with us. I can't tell you what to do as a practice. Ultimately, that whole safety check review is your responsibility. I can only tell you what you should be doing rather than what you decide to do. Okay, are there any questions? I'm happy to stay on to take questions, and I'm really happy to get feedback on things that you feel like we need to cover further, you feel like I've either lost you on. The main purpose of this session was to try and get you going. I in particular with alcohol, that you understood what's been built for you. So I didn't want you to waste time trying to create stuff yourself when you realise that it's all done for you. Okay, so if we look at questions, Vera, do you want to go first?
Oh, yes, thank you. Just a quick question, I promise. I wanted to set up the Cerner to the Ealing network PCN, waiting for the IT service desk for over a month. So it looks like I can't have the access code from them. Where can I get it?
Have a look at the description on my YouTube video. You'll find some details there about setup. It's not in the actual video. And if you have an email trail where you're not getting a response, forward it to me, and then I can see what I can do as well.
Super,
by the way,
thank you very much.
I've even been chasing the London Care Record team for one, and I'm talking about the North West London team. So I do know that they are slow to respond with certain things. So yeah, I understand the frustration. I think most practices in are set up. I think the issue is that a lot of staff don't know it exists.
Yeah.
More than and when I say set up, there's a setup that technically you're set up. There's probably that you haven't put, some practices haven't put it in their clinical tree, haven't put it as a shortcut, so it's one click away. The video shows you how to get that set up, and then their staff don't always know that it exists and how to use it.
My problem that probably we need a different password, encryption password and password key for the PCN than for the practice.
Yeah. So if there's an email trail with the team and you're not getting a response, just forward it to me and I'll see if I can try to escalate it.
Super. Thank you very much for your help. Thank you.
Right.
There's a few questions in
Victoria.
the
Yeah,
chat.
I'm gonna go to chat questions at the end. But Victoria, do you want to come next?
Hi, it was really quick because we've had some discussion. What are you doing in terms of, are you getting consent for every patient if you're using Heidi? What we were thinking is get consent when we check their name, and then when we have the consent, then press play, so that there's obviously no patient detail.
Do you know what? I joined a webinar. Maybe I'll share the recording of this webinar. And actually in the webinar, we had representation from Heidi taught us. I'll share the link. hopefully you see that I try to give the honest approach. Like I test things thinking, what would the average user do? I do not believe the average user after a period of time will keep remembering to tell the patient. And there's a couple of reasons for that. If you get so used to using it, you're going to forget that it's there. Like it's not a big deal as you're a clinician. You're going to get confused about patients who you've already used it with before, and you don't need to ask them again because they've used it once. You kind of thought it's implied consent versus a new patient who's never used it before. You're going to get confused. And then we're all busy people. We are going to make mistakes. So even if you had a practice policy, you've got to ask the patient. I think it will happen over time. So that's my personal view. I don't know if any of you think that I'm being realistic, but I don't think you can beat up your staff thinking, why didn't you get consent? So I think this is why I'm thinking, do you do all the soft things like do you discuss it with your PPG? Do you put it in a newsletter? Do you put it like your practice decide to use it? Do you put a little poster in reception? Do you put it on the practice website? Do you put it in the telephony message? Particularly if you're using AI to transcribe your phone calls, do you put it there so that actually, even if your staff didn't say to the patient, you can say to them, if you did ever get a complaint, you can respond by saying, well, look, we did these other steps as well. We're sorry on this occasion you felt
that's
that you
the
weren't
approach we've taken, but a new salary GP has been looked into it, like when she first started yesterday, and the Heidi website says that you should get consent for every single time.
The DPO for North West London does not think you need to get consent every time.
Okay.
So the DPO has, and I think it's a really sensible, pragmatic position. And there was a lot of discussion, and it was wide. The clinical leads, we were all involved in that discussion. And I think it is the right decision, and also the different products. Actually, Heidi was on the call. You can see my response, and Heidi, I think you'll see the Heidi lead did shake her head in acknowledgement that what I was saying was kind of right. I think people are going to forget. I also don't think it's really, really correct consent. Like the patient, when you send a blurb, they don't really fully take it in. They'll probably say, yeah, it's fine. I don't think you can have a decent conversation. And my view is if the patient asks questions, what I suggest you do is ditch it for that consultation. Don't have time. Give them the explainer, give them the leaflet if you need to, and suggest you discuss it for the next consultation so they don't feel pressurized to make a quick decision and you're eating into your 10-minute consultation time.
Okay, thank you.
Okay. Going through the questions on the chat. So no bars for BP contraception. I've raised to the national team that I personally think practices will just use the same bars functionality and just type in, can you do BP check and contraception? I've raised that as a risk. Technically, you can still send it that way. I won't go into the details about design stuff, but I think there's some design flaws, and I don't think it's TPP's fault, by the way. I think it's more of a national, some of the technical limitations of that functionality. So first of all, I imagine some practices will use bars to just type in, can you check their blood pressure? And I think some of the pharmacies will be okay about it, but there'll be some conversation about it. But you can do still the word referral form. But if you look at my System 1 template, I've done the communication annex presets. Personally, I think you should just be signposting for BP and contraception. They're walk-in services. So it's fastest for you just to send the patient a contraception signposting text message. It also mitigates risk. It will show them it gives them a link to where they find all the pharmacies that can do the contraception service. Do you really want to have a long conversation about, do you want a pharmacy near your workplace? Do you want it near your home? It avoids all that workload for you with doing a referral. Similar with BP check, but there's one caveat. With BP check, if they're known blood pressure, the pharmacist, and obviously if you look at the criteria, they have to be above 14, not known to have hypertension, then they can walk in, you can signpost. But if they're known blood pressure and you want them to do a BP check, they can only do it as a referral. So that's the only time where I think as a blood pressure check, I would do a referral, is if they've got known blood pressure, or and be more specific. Even then, though, a lot of pharmacies will accept a text as proof. They just need to have proof to NHS England. You could save the patient a text saying, I would like you to show this to the patient. I would like you to get there to check the blood pressure. That is acceptable. It's probably not the greatest experience for the pharmacist, but they can accept that. So you can still do the word form. Personally, I'd also think about using AccuMails if your practice is using AccuMail as a quick way to send an email to that pharmacist. That's another option as well. So like my previous video did show using word form or AccuMail, and then hopefully the bars functionality will enhance it so that formally you can choose a drop down option to say you want to do a blood pressure or contraception referral. But anyway, my key point is signpost as much as possible to reduce your workload. Victoria, yeah, can you please send photographs? I know it sounds really micromanaging. You can blame me, but first of all, just a real proof that you've done it. And I would love to, if you take a photograph that you're happy to share, we'd love to see a collage of all the photographs together. It'll be quite interesting to just show, to see, look, so just take a photograph anywhere near your reception desk, anywhere near your outside window to just prove to us that you put it up. And yet you can blame me for that. Why on earth you've been asked to do that? So I'm really sorry.
That's fine. I just didn't. It doesn't give an email. I've just sent it to nhsnwl.ealing. It didn't say where to send it to.
Okay. We'll pick that up afterwards. And by the way, you may think I'm being a bit anal, but I have literally, like, for example, by the way, I'm not asking just you to do it. I've been working with the trust to do it. I'm trying to sort out the problems at the root cause. The maternity units, I'm trying to get them to put up the posters so that it solves a problem for you. The baby is registered by the parent before they've even been discharged. And I have seen them I've emailed them the right posters and then they send me the photograph and they put up the wrong poster. So sometimes it just helps me just to quickly check you have done the right poster, because some people get confused. What is the registration poster? Okay. Any other last questions? The question about when a patient registers online, we still need to contact them to fill in lots of other details and stuff like that. I completely get that practices may feel they need to do all of that. I think you just also need to think about what are other practices around the country doing. 1 in 6, or even 1 in 5, are paying for third-party automation companies to automate their registration because they want to reduce their workload. And most of them have ditched all of those steps. So I also think it's a time to really rethink your practice processes versus workload. How much benefit do we get? How much benefit do you get from agreements? Do they find it easy to sign these things? A lot of them don't have printers. They don't know often how to have digital signatures to things. Versus, is it more like a charter approach? What if you kind of had this on your webpage, all these views, and then when they register, do you add a process where you text them a link saying, this is our practice agreement, this is how I'll conduct our charter with how we expect for you as a patient to liaise with us and us our responsibility to you. I mean, I'm just pinning them out there. I'm not trying to micromanage your processes, but I'm just trying to think about how do you reduce your workload with this, because it's a growing trend and practices across that country are going in that direction of just automating it, trying to reduce that workload to register the patient. So maybe just an opportunity to rethink your whole registration process. And I'm not trying to take away your autonomy about what you feel is right for your practice as well, but I'm just trying to be helpful about what could help reduce your workload. Okay. I know we've run over. We've got a few more moments. I feel like I've totally missed out Finn and all the amazing work that Finn, Liz and the team have done. So I don't know if there's a chance that if you could hang on, that Finn could come in with some final comments about, I raced over what her team were doing with the NHS app. Would you mind if she just says a couple of minutes? I know we've gone massively over. So Finn, would you like to just explain what you've been doing?
So we have got Age UK who are going to be doing the visits for the NHS app training. This is more just a general NHS app session. So they don't have all the System 1 functionality, and lots of questions are coming back about specific System 1 bits. So on the Google link where you've got your visit, there'll be an FAQ. So all the questions that are coming in, we're going to put the answers there. And we're also going to hopefully have a session at every DDAP meeting, which happens, I think, every month, that will be specific to the NHS app. And hopefully if lots of your staff become NHS ambassadors, we can all help each other with the questions, because I think NHS app is changing rapidly. So what might be right today is not going to be right in 3 weeks time, sort of thing. So the visits are all on the Google Sheet. Everyone's had an email. I'm chasing everyone who hasn't got back to me to confirm their visit. If you've had your visit, hopefully it went well, and any feedback about it would be great, so then we can inform future visits. And Liz and I have both done the NHS app training. Liz is much more techie than me, but if there are questions, we will try and help if the Age UK people can't answer all of them, because they are more just on the NHS app. So that's it in a whistle stop. And if there's any questions, then please do let us know. Just reach out to us. We're really keen to kind of make it work. And your posters will be coming with the trainer. So when you've got your visit, they will be bringing the posters with them. And if you've had your visit and they didn't bring the posters, they're coming to you in the post. They were sent last week, so hopefully you should get them soon. Surinder.
Yes, sorry, Finn. That's fine. I've just not received any confirmation. I agreed to the 15th of January. I think that was the earliest available, but I've not received a confirmation for that. whether
Yeah,
it's
so
been
we were
agreed or
trying to
not.
get you an earlier one.
Oh, you were.
So-
Oh, that'd be great if you
So
could.
that's on my
Thank
to-do list. We're trying to get you an
Thank you.
earlier one. Yeah,
That's
no
lovely.
problem.
Thank
I'll
you.
try and do that this week. I'll make
Sure,
sure you've got your
thank you.
date. Yeah.
Thank you.
Okay. The things like NHS app dashboard data. Can I just say that the digital transformation team in North West London do try to provide reports for you. You can access the dashboard directly. I have explained in the past how you can do that, and I think AGK. Finn, if you correct me correctly, they're going around with data when they do the visits. Is that correct?
We have the data, so we can
yeah,
give it to them.
yeah,
So and I think
yeah.
we've published that, and if not, we
Yeah.
can add that into the Google Sheets.
And
so there's
one of the questions chatted was about was it pulled through to Wisit. I personally think that there definitely has been discussions about pulling it through. I actually haven't seen whether they've done it yet or not, but I think there could also be a lag. So you know, like how we talked about NHS app, it's not just about NHS app, it's also then about are they live from messaging, have they got notifications turned on. So I think the NHS app dashboards are used for general promotion. It doesn't resolve the potential dilemmas you have about NHS app messaging. And sorry, just I'm going to say one last point about NHS messaging in case I've confused people. The notification issue is this: if the fear is that with text, it's easy to spot when it arrives. With NHS app, if you don't have notifications turned on, should you really be focused on sending them an NHS app message? Would it be better just to send them a text? So a lot of the systems are designed not to send the message to the NHS app, or at least assume that it's failed. If they haven't got notifications turned on. So that status of whether they got notifications turned on or off is actually really important for us when we're thinking about communicating with the patient direct to the NHS app. Otherwise, we're going to get frustrated that they're missing the message, and we think, well, it wasn't worth the 2p saving because it cost me a lot more having to now chase them. And so, yeah. So I don't think Wisit will ever resolve that element of NHS app messaging status. Okay, anything else? Okay, I'm really genuinely sorry for going over on time. I really hope your rest of your afternoon is not so busy. The recording, we'll get it shared as soon as we can. And in the chat, if there's any final questions, I will definitely answer them afterwards. So watch your chat if I ping some answer to you. And then finally, if there's some gaps, be really, really direct. I did rush to get this all ready for today. So if you think things I did not make clear, literally email me because I can try to see if I can tweak any of the slides or add any extra slides to make it clearer. Okay, great. So thank you so much, and hope you have a reasonable afternoon. Take care.
Thank
you.
you,
That was so
Shanka.
helpful.
Yeah,
Thank you.
Thank you.